Introduction. So, Dr. Hussein here is a medical doctor and a specialist in bioethics and public health, and he has very graciously agreed to come give us this very important, lecture on a very important topic. He's currently a medical ethics and law ethics lecturer and professor in law in Trinity College Dublin in Ireland. And he has extensive experience in bioethics and public health for the past 15 years or so, that spans across Sudan, Canada, the UK, Ireland, and some places in the Middle East. Notably, he also founded one of the first bioethics departments at King Fahad's Medical City in Saudi. And we're very happy to have him here with us, inshallah. But before we begin, just a disclaimer, logistics from RCSI as always. We have to read a thing. So the views expressed at this meeting/presentation are the views and ideas of said individuals only. They do not necessarily present the views and beliefs or attributes of the Royal College of Surgeons and RCSI. In addition, the referral to any product, services, directions, or advice by any parties at this event does not necessarily constitute an endorsement of any kind by RCSI. So without further ado, Doctor, if you're happy to go, we're all happy and ready set.
So let's start. So today, inshallah, we're going to talk about, first of all, again, one of the things that I like is about and this is the scheme that just Amr just read, and I have my own one, so that kind of like, first of all, because we're talking about some of the religious foundations and very religious or very specific terms that we are going to talk about, and here I'm not here as a scholar. Or not even as a knowledge seeker, because these terminology have meaning, so I do not fulfill these criteria. So think of me like a knowledge sharer. I have learned what I'm going to present with you today from very generous scholars and colleagues who taught me a lot about that. So this is one thing, and again, these are my views and my understanding of the resources, not necessarily by any means should replace or use to argue against any established religious ruling fatwa. And it's also advisable, not only for the sake of this lecture as a disclaimer, but also in the whole life. It's usually, you should always refer to the scholars, and this is always the analogy between, for example, if you have a question in, say, about kidney, for example, or we're going to start with some information that we need to know more about kidney. So more likely than not, you should be going for a nephrologist, for example. You might ask your colleague just in case they know something about it, but if you want something like more solid, then you'll go to the expert, right? So this is one of the key messages. Perhaps let me start by that.
Yeah, it's recording. Yeah.
Okay, great, thank you. So basically, what I think when medicine is meaning, I think what you have shared is more or less the in essence, it is about critical thinking, it's about purpose, it's about fulfillment, about impact and satisfaction. So, and there's Ahmad Saleh here as well. So in essence, it's about finding a purpose in your practice of medicine. And to find the purpose in your practice of medicine, you need to find this meaning as a student. And I assume that most of you, if not all of you, are medical students. Anyway, so it's really important to have this in mind as well. So for today, we're going to talk about, generally speaking, three main ideas. The first is how for the Islamic medicine, or the Islamic approach to medicine, to be more specific, there is this level of integration between the morality, legality, marriage, and creed, and we'll come to that in a minute. And then we are going to touch on what you have just shared in terms of what does it mean to be a Muslim doctor or doctor practicing with this Islamic perspective, and would it make any difference at all? Then I'm going to present with you, and perhaps this is the core of my presentation today, is about the 5+5 framework, and I will explain what you mean by that. It is an approach that is based on the five major purposes or goals of Sharia, which are the so-called Maqasid al-Sharia. And the other 5 are the major Fiqhi Principles, and we'll talk about them, what they mean by this, and we try to apply them to a number of cases. So when we talk about the Islamic perspective, so for example, if when and this is perhaps if my students, some of my students are attending, so most probably this is the way I'm going to teach them, which is basically what are the factors that affect our decision making, right? At the personal level, at the professional level, and at the community level. So in essence, there are different factors that affect our attitudes and the way we behave. In most of the quote unquote Western or the secular communities where the role of the religion is basically set aside or I won't say abandoned as a negative way, but in essence, it's about the role of the religion is not leading in that sense. So there are cultural issues. There are obviously the law. Everybody should follow the law, and then we have the morality, which is framed by the philosophical theories, and then the political theories. It depends on where you are on the spectrum. Even in the most of the global north countries, for example, across the Atlantic, basically, whether it's in Europe, whether it's in the States or Canada, they have different models of democracy, different understanding of liberties. And this is essential as well for them, depending on what kind of philosophical and political theory that they are basically adopting on the cultural aspects as well. However, when we talk about Islam or from Islamic perspective, and this is one thing that perhaps I need to start by clarifying by when we talk about Sharia, some people have very limited understanding of what Sharia is. So basically, it's about the punitive or the punitive parts of a Sharia, or sometimes even the word Sharia is sometimes is most of the time, unfortunately, is translated as the Islamic law, which is not right. I mean, even at the scholarly level, at the terminology level, this is not correct. Sharia has four main components. One of them is al-akhlaq, which is the manners or morality or ethics. It depends on how you want to translate that. We have al-ibadat. Okay, this is the acts of worship and the rituals. Okay, so for example, we pray 5 times, which is basically, for example, the or the pillars of Islam. So we have al-ibadat, and then we have al-mu'amalat, which are the transactions. Okay, so this includes the social, the economical, the legal interactions between the individuals themselves and the individuals and the society, whether it's transactions in the financial transactions, or it's marriage, inheritance, and the criminal law. And then we have the creed or al-aqidah. So basically, it is the theological belief or creed. It encompasses the six core tenets of faith, which are, by the way,
Belief in Allah, the angels, the Day of Judgment, the books, the messengers, the Qada wal Qadr. I think that's
yeah, Ahsan. Okay, so these are the main aspects. So basically, which are more or less they are summarized in the last ayah, in the last couple of ayat in Surah Al-Baqarah. آمن الرسول بما أنزل إليه من ربه المؤمنين كل آمن بالله وملائكته وكتبه ورسله. So basically, these are the core tenets of it. So when we're talking about Sharia and Islamic Sharia, it's really important to have this comprehensive understanding, and they are integral to one another. In other words, we cannot say that worshiping is different. So I believe in something. This is my creed, and I do something else, or the legality goes in one direction and the morality goes in another direction. In a secular community, and we can discuss this later on. In a secular community, this is the case. For example, I give you an example. The termination of pregnancy. What is the legality of termination of pregnancy, aka abortion, now in Ireland?
Legal.
It is legal, decriminalized. How about in 2017, 2016?
Legal.
Was not legal. So what happened is that the law changed. But does that mean that this act was immoral? Well, 6, 7, 8 years ago, and now it's becoming moral? This was not the case. So this is one of the issues, basically, about the separation or the parallel approach rather than the integrated approach. So Islam, in many ways, provide this level of integration between all the aspects. And if you think about it, these 4 components is about your relationship with yourself, your relationship with your with the other individuals in the community, starting with obviously with your family and then the wider community. It's your relationship with the society as a whole, and then your relationship with Allah subhanahu wa ta'ala. So it's this level of integration. You live as one, and this level of oneness, and this is one of the great lessons that I've learned from my mentor and my teacher, Prof. Omar Kasuri. May Allah extend in his age and bless his knowledge and his efforts. And he has a very I would say unique understanding of uniqueness of Allah, or the oneness. What he said, like, it's not about the oneness of Allah and that's it. This is the normal approach or the usual approach. He said the oneness, al-wahdaniyya, it's about you become one with yourself, with your belief, with your acts. This level of oneness with yourself is kind of the reflection or the extension of your belief in oneness of Allah, the uniqueness of Allah. This is one thing. Also, the one of the main concepts that I wanted to clarify from the very beginning. So in many ways, these components are interconnected, and they form kind of a holistic framework for a living, balanced, and purposeful life. So, for example, so in essence, the aqidah and the word aqidah is derived from the word aqada, it means to tie a knot. Okay, so you can imagine that when you talk about aqidah, something like you're tying a knot, like a really tight knot, and it's really hard to untie, basically. This reminds me of a very nice, of the many nice things that the Prophet ﷺ, his wife, Sayyidah Aisha, anha, she asked him, and how is your love to me, Rasulullah? He said, like a knot. He gave her an example that she could feel and sense. So it's this a knot. And every now and then she would ask me, how about the knot? He said, like, it's still there, don't worry. Okay, so anyway, it is this aqidah, it is this knot. So it's inside. It does not come back to rethink about it. And this does not mean that we should not be thinking, we should not be asking questions. And we will see with the progress and how the Maqasid al-Sharia has developed and the Qawaid al-Fiqhi has developed, how the scholars really put a lot of effort throughout hundreds of years, I would say. So the second is al-akhlaq, or again the ethics or the morality, however you want to translate it. It's about shaping the moral character and the behavior. So what you believe in is reflected in way, and this is almost always in the Quran. الَّذِينَ آمَنُوا وَعَمِلُوا الصَّالِحَاتِ. You believe and do the good deeds. They are not separated. They would never be separated. If you have a true belief, then you should be applying what you believe in. And this is one of the main, and this is what differentiates true believers from hypocrites. May Allah prevent us all from that. And then the ibadah, which is basically the spiritual connection between you and Allah subhanahu wa ta'ala. Okay. And then the mu'amalat is about, their connection or your transactions or the way you are dealing with other, the social and economical system as well. So this is kind of like, this level of integration is really important to understand and to apply this to your being as a human, your being as a Muslim, and being as a medical student. Okay, so for example, what does aqidah mean to me, or what does akhlaq mean to your ibadah or mu'amalat? So for example, the aqidah, the belief that I have, it gives me a better understanding, or guides my understanding of life, death, and divine decree. And this is really important, for example, and this is specifically important in two aspects. For example, the definition of death, okay, and issues related to brain death, or the so-called clinical death, and the persistent vegetative state, and all of this kind of terminology. It's really important to understand what death means and your role in this. In addition to that, it's part of your aqidah. It's because we believe in Allah subhanahu wa ta'ala as the life giver and basically his the life taker. So لكل أجل كتاب, for each soul, if you wish, there's an end point. And this is the importance of understanding that we as medical, as practitioners, our role is, we are just like asbab, we are reasons, we are tools. We are not the ones who bring the cure. It's not the antibiotic that you give. It's not the chemotherapy that you give. It's not the surgery that you did per se. The surgery, the antibiotic, the pills, whatever you did for your patient is a tool. But Allah subhanahu wa ta'ala is the one who would get the cure in that tool or not. And that's why we do the same surgery to very similar conditions. Many of them succeed, alhamdulillah, but some of them do not. Most of the children are born okay, but some of them are not. And so on. So there are a lot of examples about that. And this is the importance of always try to remember that you are a tool. And this is one of the prayers that we were taught as medical students. Allahumma ja'alni min asbab rahmatik. Allah, you are praying to Allah to make you one of the tools, one of the reasons, one of the ways through which the mercy of Allah is coming to his servants and to his creations, right? In terms of akhlaq, this is a very long talk by itself, and we have curriculum for that, but it's not in the Islamic one. But anyway, it's about the importance of having this level of empathy, the ethical behavior, patient-centered care. This is really important. When it comes to al-ibadat, it's really important to remind ourselves to have a good understanding of these ibadat or these worship and rituals in both ways. First, with the spiritual meaning, which is to maintain this level of connection between you and Allah, and don't get distracted with your studying or your business, and we'll come. There are a few exceptions that we'll talk about later. But anyway, this is at the spiritual level, so you keep this level of connection. Omar, if you don't mind, can you take care of the chats? I don't want to be distracted by the chat. Okay, thank you. This is one thing, and the other is about to know let's say the technicalities, if you wish, of an ibadah. There are a few exceptions. For example, the purity of the patient, taharat al-marid, who cannot use water, for example, who cannot take a shower. Okay, and then the al-ibadat, and we will come to that when it comes to show how the ease, the religion, the faith, subhanAllah, Islam is trying to help the people to make their life easier. And then we have al-mu'amalat, which informs the ethical decision making by the confidentiality, the informed consent, and the resource allocation. Okay, so most of you, understandably, it's about helping others and fulfilling a religious duty as well. So in a way, they are not separate. And even, by the way, if you're talking about the intellectual challenge or the financial stability, okay, or whatever other reason, it's don't be ashamed of it. I mean, even because we'll talk about that when it comes to the intention. It's really important to understand that the intentions is what really matter. Okay, when you want to have a good income, this is absolutely fine. I mean, this is a duty on you if you think about it, because you need to fulfill your needs and the needs of those who you are taking care of. So in many ways, Islam or the practice of medicine in Islam is meaningful in that sense. So we have the first is the intention, and we will talk about that. We have a good chunk of our talk is about the intentions as well. And as I've just said, if you want to get the money, that's fine, as long as your intention is to be fulfilled. Don't ask people for and to have this level of fulfillment as well, and independence. And when you have the money, you can give the money, you can share it, you can help the people to feel better, and then a reward for helping others, subhanallah. So there are numerous hadith about and for this, not to me, I assume that most of the attendees, if not all of them, are Muslim, but in case the hadith is basically a documentation of what the Prophet Muhammad said, did, approved, or disapproved. And this is like a general, and most of the sunnah that we have, or most is about what he said, sallallahu alaihi wasallam, or what he did and was reported by the companions at the time. So there are many hadiths about how the what to do for the patient and visiting the patient, and the reward that you get for visiting the patient. And even the dead person, if you attend their funeral, and if you go and for them until to the graveyard, and then just like 2 mountains of literally, as Hadith said, 2 mountains of hasanat, of good deeds, just by attending a funeral and going to the graveyard to have someone buried, subhanAllah. And fulfilling a trust, which is basically fulfilling the man, as you correctly mentioned about that. So, and then it's a sadaqah jariyah. So, for example, because Allah subhanahu wa ta'ala said, like, ولذلك كتبنا على إسرائيل إنه من أحياها فكأنما أحيا الناس جميعا. So, and this is, Allah is saying that if you make a life alive, or someone alive, which is basically, obviously we don't get alive, but basically to help people to stay alive and stay basically healthy in this life, as if you have given life to all the humanity. Okay, so how many humans are there now? Like 7 billion. So if you help one person, as if you have helped 7 billion humans. Okay, and the opposite is also true. That's why we have to be really careful in terms of this, and this is all about the intention as well. And we talk about the Maqasid al-Sharia and gratitude to Allah subhanahu wa ta'ala, because you are in a very special position, in a very special place where you can help the people with, and to show dedication and to gain knowledge and a lot of good things, actually. But given that this is not the core of my talk today, I want to move to the second section, which is basically to introduce you to the framework that I'm dealing with now. So if I may, I'm going to read it. This is slightly modified case. It's a real case. It happened in one of the hospitals that I worked with as in the clinical ethics committee, and the case came to us. The tool, this is her name anyway. She was 36, Muslim Arab woman, a mother of 2 children. They are alive and well. She has currently 15 weeks. She's an age with a normal viable fetus. Anyway, she was diagnosed to cytoadenocarcinoma with signs of metastasis. The oncology board recommended the termination of pregnancy to allow immediate chemotherapy. Then the consultants, including the physician and gynecologist, supported this recommendation. However, she refused to terminate the pregnancy, and she refused to start the chemotherapy. Okay, and we'll just, it's like a food for thought, and then we'll discuss it inshallah near the end of our session. The other case, and this is again a new case. I mean, we have lived, almost all of us through that case anyway. So during COVID-19 pandemic, as you are aware, and then one of the Arab governments, I don't want to mention him, although it was a really successful case story, or there's a case study, sorry. So they implemented a mandatory vaccination, like almost any other country anyway, policy to address the rapid spread of the virus, which posed a serious threat to the public health. And then the policy mandated that all citizens to move to enter some, the shopping malls, and obviously to travel and so on, you should provide the proof of that you have been vaccinated. And some of like, again, almost every country in the world where people are either hesitant or reluctant, or simply they don't trust the government in a way, or they don't trust the pharmaceutical companies anyway. These are the approach, basically. So we have something called Maqasid al-Sharia, or what we can be translated as the higher goals or the higher purposes of the Islam of al-Sharia. And as we said, the Islamic law is not a fair translation of the word. I'm using it because this is the most of the literature is for some reason they couldn't find a clear synonym or translation, a correct translation for the word Sharia. So they just kept it the Islamic law as is. So in linguistically, so it is from the word qasada. Okay, it's from maqasid is a plural of maqsad, and the maqsad is from the word qasada, and which has to aim or to intend or to strive or to head towards someone or something or someplace. So it's about the purpose or the goal or the objective. And it in the wider context and the wider meaning of al-maqasid, it's about the higher objective and purposes of Islamic law. In other words, think about it this way: why do we do what we do? Because Allah told us to do that, right? This is the easiest answer. Okay, However, in many instances, and we'll talk about it really briefly, because the history is not the purpose of our talk today, and I don't want to keep it longer than needed. So in a way, it's about the higher objective and the purposes of Islamic law, and the main aim is to maintain the well-being or the maslahah of the individuals and society in life and the hereafter. So it's about this, and this is one thing, by the way, this is another level of integration that we as Muslims enjoy, if you wish. It's about thinking of our lives as a continuum. So death is just a simple transition from one phase to another. And this is like a temporal life to the hereafter. And this is, by the way, the view shared by almost all the believers worldwide, right? It's about the death, and they were going to heaven, or they will they'll be rewarded for the good deeds they did, or vice versa. So they initially came from Al-Quran and Sunnah, and then developed by the Muslim scholars throughout the years. So this is kind of like a summary of them and a few examples as well. For example, the levels of al-Maqasid are divided into three, and we'll talk about Imam al-Shatibi or Imam al-Ghazali and among other scholars who have worked on kind of like this level of categorization. So for Imam al-Shatibi, and Imam al-Ghazali, actually, he's the one who said that these are the five. For Imam al-Shatibi, he's the one who said these levels of priorities of goals. So we have the essentials, the ad-daruriyat. Ad-daruriyat are the basic needs for survival and well-being. In other words, without these daruriyat, without these essentials, the life will be extremely hard, or basically could terminate altogether, right? And then we have al-hajiyat, which is basically the needs, the things that complementary needs that improve the quality of life. It's not a matter of life and death, but they are essential, or they are needed in our life. And then we have the embellishments, which are the luxurious things, if you wish, about the enhancement that we can add, the beauty and excellence. Okay, so our focus today, given the time that we have, is about ad-daruriyat, the essentials. And there was kind of like, historically speaking, there is some level of agreement that these are the five main essentials that we as Muslims and as humans, if you think about it, need to enjoy. We need these essential things. First is the whatever the legislation from legal perspective. So whatever we have in Islam that do or do not, okay, there's a purpose for that. Okay, the purposes are the main, these are the five main purposes or the main goals, which is basically first, preservation of faith. We need to hifzuddin. Hifzuddin is about to protect the religious beliefs and practices. Okay, and then hifzun nafs, which is the preservation of life, and then the preservation of intellect or mind. Okay, and then preservation of lineage or progeny, and then the preservation of wealth. Just because this is one of the main areas, and I don't want to spend the time going through the slide. You will have the slide later on, so let's have a discussion about that. First of all, let's say how can we see these principles, or these goals applied in medicine, in the practice of medicine. And there is a long argument, by the way, about which comes first, right? So is it that the preservation of life comes first, or the preservation of hifzuddin comes first? And to my knowledge, that most of the scholars in this area, they give the priority to preservation of life. And for example, we all know that consumption of alcohol, okay, and eating pork, for example, is haram. It's not legal for Muslims to do that. However, if there is, I cannot imagine any scenario that this could happen, but just while you're lost in the desert, or may Allah forbid, like for example, a few planes have been crashing, may Allah protect you all. Anyway, and then you felt in the middle of nowhere, and the only drink that you can have, otherwise you're gonna die of thirst or something. So this is the only thing. Perhaps a more medically relevant example was that the insulin and some of the organs in the early days of transplantation and the early days of insulin they were derived from pigs. They were pork based basically, and at the time there were few alternatives for the insulin, for instance, apart from the pork based one. Then when the bovine one came, and then the human like came, and so there was a result. But at one point of time, if there is a diabetic patient who needs insulin to survive basically, and the only available insulin, for example, was this pork based, then there's an exception for that. Okay, so although there's a contradiction between Hifzuddin, the preservation of faith. So my faith is telling me you should not be consuming pork, but at the same time, there's another goal, which is the preservation of life. Here, the preservation of life takes priority. And we have seen this, for example, when some of the early Sahaba were tortured by the disbelievers in Mecca before the migration. They were tortured really hard to the point that they said, like, if you say something bad, insult Muhammad alayhi, and we will stop. And he couldn't bear it. He did, and then he came to the Prophet ﷺ crying and said, like, I insulted you and said bad things about you, but I couldn't bear it. I said, like, and he gave him a rule, like, وَإِنْ عَادُوا فَعُدْ. Yani if they come back to torture you and ask you to insult me, do that. Why? Because here the preservation of nafs, of the soul, of the life, is given priority to that of faith, with a few exceptions, as you can imagine. Someone is speaking, I really can't hear.
Maybe like in preservation of progeny, where you need to like confirm who's the father or something.
Okay, so this is one thing, and again, it's quite interesting that you have chosen this, because it's not the easiest example. Let me start with the easiest example, and then we'll come to the point that you've raised. When we talk about the preservation of life, think about it. Your main role as a medical doctor, as a medical practitioner, as a healthcare provider, is the preservation of life. If you think about it, you want to keep the healthy people healthy. Okay, if you're working like in public health, for example, or preventive medicine, and for those who got sick, you want to basically, you are aiming at curing them, right? Which is basically bringing them back to life in a way, the good quality of life, I mean, right? So this is the main goal, if you think about it. When it comes to the example that our brother here gave, is about the preservation of progeny or lineage, because it's really important from a Islamic perspective, is that each and every person, they have the right to know, not only to know who their parents are, but their responsibilities. And that's why the marriage is a contract. Like, it's a contract in the literal legal meaning of a contract, where each of the parties can put their own conditions. Okay, so because of that, any product of this relationship, if you might call the children products, there is a responsibility. It's not a matter of like just like it's a one-time thing and then you disappear, and then the single mother phenomenon happens. It's something that you have to commit to, and there are responsibilities for you as a parent. So this is the importance of the progeny and the lineage. We need to know who's the father, basically. This is really important, in addition to many examples as well. Hifzul Aql, this is, for example, it's really important to understand that we have to maintain the intellect of the people, the sound mind of the people. And this is why, for example, alcohol is prohibited, right? Because it's just like, it's called khamr because khamr means to cover, and hence the word khimar, which means what covers, right? So it covers the brain. Okay, and your ability to think and behave properly. So let's keep moving. So there is a very long history for al-Maqasid. It's just like it's been in essence it's been developing throughout the years. It started from some are mentioned in the Quran. For example, now in في آية الصيام. Can someone read it for me? يا أيها الذين آمنوا كتب عليكم الصيام.
كتب على الذين من قبلكم.
أيوة.
لعلكم تتقون.
لعلكم تتقون. So Allah is saying that, oh, those who you believe, I have decreed fasting on you as Muslims, as I have decreed it on the nations before you, so that you can attain taqwa. Okay, the piety or the purity or whatever, however you want to translate. So Allah subhanahu wa ta'ala in many ayat, in many Allah is referring to the purpose. لعلكم تتقون, لعلكم تفلحون, لعلكم تشكرون, which means that so that you might think, so that you might thank or praise, so that you might ponder, and so on. So Allah subhanahu wa ta'ala is asking us to do things, and then at the very end of the ayah, gives us the purpose or the goal. So from there, the Sahaba thought that Allah is kind of like inviting us to think about, okay, Allah is asking us to do this, then so what is the purpose? What is the goal? Okay, so this started, and then there are many contributions. And again, for the sake of time, I'm not going to a lot of the history. I want to move more to the contemporary approaches and the application in medical care. This is but anyway, it's fair to at least these are some of the main scholars that if you're interested, so please go and revise their work. Al-Imam al-Ghazali, he is the one, as I mentioned, he kind of systematized the 5 essentials as we just described them. Ibn al-Qayyim al-Jawziyya طبعا, and Ibn Taymiyyah, great scholars, and they have their contributions to that as well. Al-Shatibi and his book Al-Muwafaqat is kind of like the magnus opus, as they call it. It's about he is the one who basically who is kind of like the godfather or the founder, if you wish, of Ilm al-Maqasid. So it's really, his contributions are really important and pivotal for that. In a more recent contemporary approaches, actually we have Tahir ibn Ashur from Tunisia, and Al-Qaradawi, and then we have Tariq Ramadan, among others, and we'll show you them. So what do you mean by contemporary approach? In the contemporary approach of al-Maqasid, what's happening is, this is like a general idea. They try to expand it beyond these 5. For example, they're talking about human rights as one of the essentials, okay? Or for example, democracy and political liberty, yeah, is one. The civilizational goals, as Tahir ibn Ashur is describing them. So what that and Tariq Ramadan as well, he has some effort to that, and Jasser Auda or Mohammad Hashim Kamali is طبعا, he's like the father of the contemporary maqasid. Whenever you just try to find something, I think he's a very good starting point, and he writes in very simple language, and it's easy to understand, and he writes in English. In addition to Jasser Auda as well, and Asim Padela, they all in English. And then Ahmed al-Rasouni, he's again a great scholar. If you can understand Arabic well, then I think he's a very unique way in approaching this. He is very well grounded in the traditional approach to Maqasid, but he has a lot of meaningful addition in case you are interested. So the second part is about the 5 major fiqh principles. So it's a method of legislation, okay? So when we're talking about the fiqh principles, in generally speaking, it's about how legislation happen, how things are legalized in Islam. How can we tell basically halal from haram, if you wish? Okay, first, during the era of the Prophet sallallahu alaihi wasallam, this was done by revelation. So Jibreel alayhi salam comes to the Prophet and tell them that, tell your people to do this or not to do that, and so on and so forth. And many people, it's throughout the Sunnah, where people, especially Arab, the Bedouins, if you think about them, they're coming from outside the Medina, stay for a little bit, ask a few questions for the Prophet, and then leave. And then to cater to certain incidents that something happened, and then Allah subhanahu wa ta'ala, for this incident, if this happens again, then do this or do that. And the necessities of the society, and also it's a reason for gradual revelation, because one of the arguments is why the Quran was not sent like one book at one time and that's it. But Quran, it was revealed munajjaman, which means like few ayat at a time, one ayah at a time, one surah at a time. It depends on the situation, because you cannot respond to a situation before the situation happens, right? So the situation happens, and then Allah subhanahu wa ta'ala makes the revelation. And as you know, at least and if there are any brothers from the Shiite sect, I apologize. Yeah, well, forgive my ignorance about that. So I'm talking about from the Sunnah perspective as well. So we have Al-Quran, obviously, the outline, the general principles and the revelation, and it's continuous in nature. So it's this level of continuity that is happening to the point that we are talking about a book that was revealed or in place for this 1446 years and counting, alhamdulillah, and the book is still the same, and it's still inspiring, it's still sparking arguments and debates and so on. Okay, and then we have the Sunnah of the Prophet sallallahu alaihi wasallam, and we talked about it as well. So what are the basis of legislation? So first of all is about the removal of difficulty or hardship, to reduction of religious obligations. And this might be surprising in a way for people who are expecting, you know, the Islam as a strict religion where a lot of things are forbidden, very few things are allowed, and this and that. This is not the case at all. And there is a classification of the fiqh principles. The fiqh is jurisprudence. It's about the knowledge or the science which is related to telling what is permissible, what is not permissible, and there is a field of knowledge known as usul al-fiqh, the roots of fiqh, the roots of jurisprudence. And the word faqiha means to have a clear understanding, comprehension of the concept. Okay, so anyway, there are different classifications. There are al-kulliyya wal-juz'iyya wal-kulliyya لكن غير كبرى أو الضابط. Anyway, this is just a matter of classification, and again, out of respect to the subject, I'm just putting that just to spark your curiosity, if you wish, about what this means. But I'm not going to what I'm going to talk about today is the 5 major fiqhi maxims, or the major fiqhi principles. They are namely the principle of intention, which can be translated as the principle of the maxim of intention, and the full name, if you wish, it's about al-umur bi maqasidiha. This is the full name, the terminology used. And then قاعدة الضرر, which is لا ضرر ولا ضرار. This is no harm is inflicted or reciprocated. And then the principles of certainty, al-yaqeen. And then the principle of custom, al-'ada muhakkama. And then the principle of hardship, al-mashaqqa tajib at-taysir. And don't worry, we are going to go through it bit by bit. So what is this? These are called the major, in the sense that they are kulliyat, which is like they are, think of it as a theory, right? Or as a general rule, a general principle. Under this principle, there are sub principles. Okay, so I will go through them so that you don't be scared from the diagram you're about to see. I'm trying to explain it for you in as simple as possible. So, for example, here, okay. So we have the principle of intention. The one of the main principles within that principle is الأمور بمقاصدها. And there's a hadith for that. And for almost every principle of these principles, or maximum of these maxims, are based on an ayah or a hadith, almost a hadith. Okay, so for example, this is based on a hadith that says hadith of Ibn Khattab, اللي هو إنما الأعمال بالنيات. إنما الأعمال بالنيات. The deeds are measured by the intention behind them. Okay, so the sub principles include there is no reward except with intention. So in other words, if I stop eating and drinking, say on Saturday, inshallah, if it's Ramadan, just like that, from when I wake up until it's sunset, does it count like, for me, that I'll be rewarded as fasting? Can you tell? Yeah.
So, Dada, can you repeat the scenario one more time?
Yes. So basically what's happening is Saturday, the first day of Ramadan, inshallah, and then I'm not eating or drinking all the daytime, and when sunset, I bring my food and eat.
I
Am I
think
reward?
there is no problem on this.
Yes, but does it count as Siyam of Ramadan? Or
No.
what makes it count as a Siyam of Ramadan, as a fasting of Ramadan?
The intention.
The intention, absolutely, and that's why it's really important. And the hadith about that you have there is no fasting. It doesn't count if you do not have the intention before the fasting. Okay. So this is one thing. The second is about the intention determines the nature of the action as well. The intention is sufficient. So and it's not always verbalized. In other words, for example, it's the consent, as you know, I think at your stage, that the consent, there are two kinds of consent: the explicit consent, which is basically the patient signs a form, for example, and there's the implicit consent. If you are asking a patient that I need to take 5 ml of your blood, and they roll up their sleeves and extend their arm, this is an implicit consent. Okay, so you don't have to verbalize or to express explicitly your intention. And this intention should be aligned with what Allah wants, what the Sharia is ordering us. And intention can change the ruling, obviously, because it's basically, and we'll give an example of that. Let's give it for the example. And then we have the principle of harm, which is basically قاعدة الضرر يزال أو لا ضرر ولا ضرار في الإسلام. So no harm should be inflicted or reciprocated in Islam. So basically, you should not be harming anyone, and you should not be returning harm to harm. Okay, this is generally speaking. So harm, for example, the intention here, it's really important. For example, and we'll give a few examples as well. So the second, I'm just trying to explain them. Okay, and then the second is the قاعدة الضرر يزال اللي هي فكرة إنه there should be no injury, no harm. We should avoid the harm, we should remove the harm. And this is obviously medical practice, because again, our practice is mostly about this, right? There's a harm, which is the illness of the patient, right? Whether it's a bacterial infection, viral infection, or whatever is going on in the person's body, then we want to restore this function by removing the harm, right? And then another rule is the lesser of the two harms. If we're basically, for example, think about it like we have two options: the say surgery and chemotherapy for some type of cancer. May Allah protect you all. So we basically try to see which is more beneficial and of the lesser harm. And preventing harm takes precedence over achieving benefits. So if we are in doubt that whether so the prevention of harm takes precedence over the achievement of benefit, and we talk about that later on, inshallah. So the individual harm is tolerated for the public interest, and this is one of the in the Western approach to ethics, they refer to this as solidarity. But now this is part of our faith, basically. And that's why, for example, in the example of mandatory vaccination, as we will see, this is something that we can all oblige to. And harm cannot be justified by a greater benefit. So it's not the matter of, like, for example, if the greater benefit is to recruit this patient for a study, because we're expecting that the study will make a new vaccine or a new drug, but it's going to harm the patient, then this is not an excuse. We cannot harm our patients based on the assumption that they will benefit from it. Okay. So, and then the third is the principle of certainty, and there are quite a few of them. Okay, so the uncertainty, to what extent are we sure of what we're doing? Okay, so for example, the original state remains until proven otherwise, which means that for example, I assume that each and everything that the doctor does for her patient or his patient is done in good faith, right? It's good with good intentions. To claim the opposite, we should be starting from a point that no, this is an evil doctor and he's more likely than not he's done something bad. No, we start from a original position, which is that of innocence. Okay, this is one thing. The second is the doubt does not negate certainty. So in other words, if we are in doubt about something and we're certain about something, then it cannot overcome. For example, I have a proof that this patient is hypertensive, I have approved that this patient is cancerous. I have approved this patient is alive or dead. Okay, then anything else, if I'm in doubt, if I have the evidence of a status, then I need another evidence of equal, quality or even better to respond to that, or to negate this certainty. And this could be interpreted in modern terms as the evidence-based medicine, where the evidence-based medicine is basically based on evidence, right? So we need to make sure that whatever we do in our practice is based on this principle as well, is that it is related to medicine, to evidence. So we have a proof for that. We are not instead of that. That said, one of the challenges that we face as practitioners, as clinicians, is that there is a level of uncertainty in most of what we do for our patients. Right? We cannot guarantee 100% that this medicine is going to work, or this surgery will succeed, or whatever that we do for our patients is 100% guaranteed. Okay, there is always some level of uncertainty about the outcome, about the prognosis, and so on. Okay. So we need to make sure that we are on as close as possible to the level of yaqeen, the certainty, the absolute certainty. But although most of our practice is within the area of ghalabatul dhann, which is the most likely thing, the most likely level of certainty. Okay, so the fourth is the principle of custom, which is basically al-'ada muhakkama, which means that whatever is happening in the what is the norm in that community, it is a reference that we can refer to in medical terms. So for the sake of time, let me take it directly to the medical context. What is the kind of like the main reference for clinical practice? To what kind of custom that you refer to in your clinical practice?
Guidelines.
Thank you. Excellent. In the clinical guidelines, right? So this is your reference. This is your custom, because it's based on the expert opinions and the evidence of the people of the experts. And this is against these customs, you're going to be judged, whatever you did. So whatever you did, and al-'ada muhakkama, which means what is the habit, what is the custom of those who, if your level of training in this discipline, in this specialty, what would they do? And you are measured against this, which is basically the clinical guidelines, if you think about it. Okay, but anyway, custom can change over time, and this is obvious. Even the clinical guidelines, they change over time based on the evidence that are there. Okay, and the custom is considered in contracts and transactions. For example, as part of your duty of care to your patient is to make sure that you are following the guidelines. Okay, and then we come to the last one, which is again very relevant to our practice of medicine, which is the principle of hardship, which is al-mashaqqa. We have to make sure that we try to ease things on the people and on our patients. For example, just one of the examples, if the patients cannot, for example, one of the conditions for the prayers to be valid is to at least for takbiratul ihram, for you should be standing up. Okay, which means that if you cannot, then you can be sitting down. If you cannot, you can be lying on your back, on your side, depending on the position that you can. If you can use water, then you have to do wudu. If you cannot, then there is tayammum. Okay, and so there is always an easier alternative. This is and this is again our mother said Aisha when she said that ما خير الرسول بين أمرين إن اختار أيسرهما ما لم يكن إثما. So whenever the Prophet was giving the chance or the choice between two things, he would go for the easier choice, unless it's something like clearly forbidden, clearly haram. Okay, but for whatever we have, that go for the easier choice for yourself and for your patient, but obviously for their patients, more important as well. So again, I will just take one of them. الضرورات تبيح المحظورات, which is the necessity permits the prohibited. Okay, and I gave an example of, for example, if there's a necessity that this patient needs the insulin, which is like pork based or derived from pork products. If this is the only thing that would lead him to survive, then we can take it. But however, the hardship is or the necessity, so it has its own limitations. Okay, so it's not like open. For example, the example that the hypothetical example that if you are going to die if you don't drink this glass of wine, say for example. Okay, fine. Or we're about to go choking, and there is the only thing that you're gonna die, and the only thing that is the nearest thing is just a glass of wine. Okay, and then you drink it just to swallow the whatever to clear your throat. Okay, don't make it a bottle. It's just a cup. Okay, so this is the thing. So the exception is only to the extent that you need. Huh? Okay. Let's move forward. That's it. Okay. Sorry. Okay. Yes, this is one of the examples, and I think it's yeah. So one of the applications of the intention is about the importance of this is that based on the intention you are either rewarded or punished, and this is one of the examples that I used to give my students. And if I tell you that a surgeon removed a patient's eye, is that a good thing or a bad thing? Did you do? What do you think of what he did?
It depends on if he has a valid reason to do so, you know?
Yeah. So it based more or less, if you think about it, it's about the intention, right? So the intention is whether if they want to have the patient. Sorry, I need to connect my charger for a second, please. Yeah. Yes. So, for example, if he's removing it because there's a cancer, for example, in the eye, and the only way is to deal with it is to remove the eye, then that's fine. If it's basically stealing it because he wants to put it in the eye bank or to give it to a rich people who is going to pay him a few $1,000s or euros for that eye, then this is an illegal. So it's about the intention, and the intention, accordingly, you can judge the liability, the legal liability based on the intention. So for this, again, a few examples that harm should be removed. So if you think about it, whatever we do for our patients is for this particular purpose, that they have harm, which is their illness, their pain, their whatever, and then it's our role to remove it. Harm is removed as much as possible. Okay, and this one even in surgery, right? If you have a dead tissue or a suspicious tissue, so you don't only remove the tissue, you try to remove even the area surrounding it, right? It depends on the place and the organ and stuff. So it's really important as healthcare provider, you aim at cure, but if you cannot, then actually you try to prevent the disease from happening, the illness from happening. If it happens, then you aim at the cure. If you couldn't, then at least to prevent the disability, and if you couldn't, at least to help them if they get disabled. And even at death, subhanallah, you still try to help them to make their death as easy, as dignified as possible. For example, the harm is not removed by equivalent harm, and obviously not more harm, right? So for example, and there's another principle which is which is the necessity does not override the rights of others. In other words, I cannot treat a patient with renal failure by basically taking a kidney without a consent from another patient just to save one, because you cannot treat harm by harm. Okay, or the benefit of one patient does not justify the harm for another patient without their consent. So again, back to Menti. Which of the principles do you think the most challenging to apply in clinical practice? That of intention, or ad-darar, the prevention of harm, or the certainty, or the hardship, or the custom? Okay. 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 Quite interesting. Yeah. Okay. Eight, nine. I think this is a kind of a sensible, expected result. Let me share it with you.
All of them is very important.
They are important. They are important, and they could be challenging at one point in a way or another. But I think it makes it. Can you see the results now?
Yeah, key.
Okay. Yeah. So obviously the certainty. I really understand why the certainty could be really problematic in many ways, because we can in most of the practice, in most of what we do for our patients, we have this level of uncertainty, which makes us a little bit unsure about whether this is the best way or this is not, or what are the alternatives and so on. Okay, especially if we're not, well, whatever the level of ignorance. For example, when something is completely new, that like COVID. Okay. So how to apply this? I mean, now we have the 5 main purposes of Sharia, and we have the 5 main Fiqhi principles. How to apply this? How to approach? If I had an ethical dilemma, and back to the two Batul cases for the termination of pregnancy, we'll try to work on it before ending this session. Which is, first of all, we have to define what are the issues at stake, what we are talking about here, right? So we have to be very clear about that. The second is, and here we can use the ethical analysis tool, even the ones found in the Western literature, okay, because it's about the analysis, it's not about the conclusion. And then we ask ourselves, is there a clear fatwa about it? Is there a real hukum, clear cutting on that or not? And then if not, then we start to basically elaborate, to think about it. So what kind of which of the goals of Sharia is involved here, and which fiqh principles can be applied, and then come to a conclusion. But again, it's not a fatwa, it's just a matter of like, you try to talk to the scholars or those who are issuing the fatwa in their language, if you wish, so that to facilitate the communication, instead of you are talking about the medical jargon as usual, and they are talking about their own terminology, the scholarly terminology and the fiqh terminology. Now we're trying just to try to bridge the level of communication. So let's apply this back to the case of Batul. So what are the cases? What are the themes here? What are the issues here? Just give me a couple of them, and we'll discuss them using the framework to present.
So the first one would be Batul's health,
Okay.
general health,
Okay.
and the fact that to be able to a certain extent restore her health, there is a therapy that will be harmful for the baby that she's carrying.
Okay. So yeah. So in essence, here we're talking about the kind of like weighing the balance between her health and the baby's health in that sense, and another issue related to her consent and her ability to make decisions on her for her own self without being forced to do that by no one. Okay, and she's an adult. She has the capacity to make her own decisions. Okay, so if we think about the Maqasid perspective for that, which kind of, or what are the goals that you think relevant to the case?
If you allow me, please, I think that you are working within a legal framework. So we're talking about abortion, for instance.
Yeah.
So as a Muslim,
Yeah.
I know in some countries it's a legal act.
Okay.
So what can you do?
Yeah, again, here we're not talking from a very strict legal perspective, but it's okay. Yes, but back to your question. I mean, from a Islam perspective, the rule is that the termination of pregnancy is prohibited unless, and this is part of the unless part. Okay, so there are a few exceptions. And by the way, this ruling is set like hundreds of years ago, if not more than 1,000. It was just legalized in Ireland a few years ago. But anyway, let's keep focused. So what's the one of the exceptions is about, and here we are talking about the balance between the preservation of life and the preservation of progeny, right? So if we go with the preservation of progeny, then we should basically keep the baby alive because we want this life to come to life, okay? And then if we're talking about and here we're talking about which life to begin with, right? I'm talking about her life and the fetus life. This is one thing. So we're talking about the preservation of life is something that we need to consider. Preservation of progeny is another. Do you think, can you see a room for the other goals? For example, the preservation of wealth or of mind or intellect?
I suppose it's like her decision versus her husband consenting on her behalf, and autonomy, I think, would come into that.
Okay, this somehow relates to it, but again about the condition here. So it relates. I'll show you a table and how this applies, and the fiqh principles as well. There are the principle of harm here in place. So, for example, which kind of and no harm should be inflicted or reciprocated. How could that apply? And we are weighing between harms, right? So, what are the harms that we are basically comparing or weighing them in the case?
The two harms would be one, the cancer that Batul has, and
Yeah.
on the other side, it would be the health of the baby.
So because the choices that we have, it's either we have three choices, right? So it's either to continue the pregnancy without chemotherapy, or to continue the pregnancy with chemotherapy, or terminate with chemotherapy, right? These are the three choices that we have here. The recommendation obviously is to terminate the pregnancy for the chemotherapy. However, she might at least to be given the option to the other option. But if she decides, for example, that I will continue, give me the chemotherapy. So we're comparing between two harms here, right? So the harm to her health, in a way, and the harm of the carcinogenic nature of the chemotherapy and how that affect the baby. So this is one way to think about how the principles could apply, how the goals could apply, and these are other factors. So and we will so this is one way of thinking about it. Okay, so basically what are the goal here, what is the maqsad in place, and these are the three options: either a termination of pregnancy with chemotherapy, or chemotherapy without abortion, or no chemotherapy, no abortion, just keep things going the way they are. Okay, so in terms of faith, for example, if you're talking about the preservation of faith, then from a very clinical perspective, so what happens is if we terminate the pregnancy, there's no chemotherapy, we're expecting that there'll be no metastasis and the better health, she would be able to worship better. So we're maintaining her ability to practice her faith. And then if you go, for example, no chemotherapy, no abortion, what happens is more likely than there'll be metastasis, and then we have multiple impairment, which could include the brain as well. So we have to another part of it, which is about the preservation of mind. In terms of preservation of wealth, yes, we are paying a little bit for the chemotherapy temporarily, but we are at the long term, we're reducing the healthcare cost out of pocket for her and as well. However, but again, if we talk about there's no chemotherapy, no abortion, basically we're not paying, we're just leaving the pregnancy go as it is. What happens is that it is less expensive temporarily, but on the longer term, it will be more expensive for her and for her husband and for the family and for the public. So what I'm trying to say here is I'm not trying to solve the problem per se, but I'm just showing you an example of how the principles and the goals and the principles could apply. So, for example, how the principle of intention here. So we need to consider: what is the general cause of for abortion? Okay. So, for example, if the doctor is trying to have the fetus for stem cell research or something, okay, then this is not proper intention, for example, but this is not the case, obviously. So in terms of harm as well, so the harm should not be inflicted, harm should be removed. This is the principle, right? So if we apply the principle, then the cancer should be removed. So to be removed, we are in favor of chemotherapy, right? And the termination of pregnancy. The level of certainty, the principle of certainty here plays an important role, by the way. And that's why most of you chose the certainty, the principle of certainty as the most challenging one, because we're not sure. We're not sure how sure we are that chemotherapy is going to cause the congenital anomalies in the child, in the fetus, I mean. Okay. We are not even quite sure that if at her stage, that even with termination of pregnancy, that the chemotherapy is going to be working well and she will cure. Okay, so we have a lot of uncertainties here. So we are dealing with the situation with some level of fluctuation as well. So if we go with chemotherapy without abortion, so what is the intention for doing this? For example, she might say that my intention is tawakkul. I want to rely on Allah, okay, and He was going to protect me. I want to be tested. I don't mind, which I don't want to be tested. We shouldn't be asking for testing from Allah, but basically, I don't mind being tested from Allah, and I'm happy to take the chances. This could be her intention, okay, which is valid. I mean, from a religious perspective, it is valid. However, when talking about the principle of harm for injury, it's harm to the fetus, okay, and this need to be removed as well. So if no chemotherapy, no abortion, then the intention is, why do we need to keep the fetus, okay? Is for the peace of Allah and fulfilling the preservation of the progeny or something else. Okay. And about the fetus, the level of certainty of no chemotherapy and no abortion, are we certain of cure and all of this? So what I'm trying to say here is for the custom, as you said, it's about the clinical, what kind of clinical guidelines are saying about this, and we can refer to this, and we have this as our evidence. This is our custom that we are referring to. Okay, so this is just an example of how we can approach an ethical issue by analyzing it using the 5 goals of Sharia and the 5 major and the sub principles as well. So I'm not sure if we have the time for a long discussion, because I want to spare the time for Q&A. So this is another example. It's about the pandemic, as we discussed it. So again, what kind of Sharia goals that you can have in mind? The preservation of
Life.
Life, obviously, for the people, for everyone. Yeah, the preservation of preservation of mind, not very relevant. And this is, again, this is an example of that they should not always apply. All of the 5 should apply. This is not the case. So how about preservation of wealth?
That could be relevant at a societal level because of the mobility.
Absolutely. And even at the individual level, if they have to pay, for example, for the vaccines, right? So and then the progeny, not so much, depends on if for example, the person is pregnant and she is concerned that if she takes the vaccine, that could affect her baby, and so on. So basically, these are the goals. How about the principles? Which kind of the fiqh principles that could apply? Do you want a reminder? We can go to the previous table. So yeah, so we have the principle of intention, al-umuru bimaqasidiha. And we have the principle of harm, which is like the harm to be removed. There is no, the harm should not be inflicted or reciprocated. And the certainty, al-yaqinu la yazulu bi-shak, doubt is not removed by, sorry, the certainty is not removed by doubt. And the hardship, al-mashaqqa تجلب التيسير, which is basically the hardship brings forth ease. And then the custom, al-'ada muhakkama, the custom is acknowledged as a legal basis. So how do they apply to the mandatory vaccination example? So for the intention, this is an example. It could be the intention of the person for not taking the vaccine, for example. Okay, so for example, again, this is tawakkul. This is I'm relying on Allah that He's going to protect me. And this is not necessarily a good argument, but let's assume that this is the intention. Okay, and the intention of the government from vaccinating the people, and well, hopefully they were not gonna like inject them with some what is the theory that they'll be injected with some microchips? Yeah, the microchips in our to read our minds and stuff like that. So let's hope that this is not the intention of the government. So the intention plays an important role in terms of harm or injury, because obviously the COVID-19 is a thing, it's a real thing, unless you, well, if you believe some conspiracy theory, which is fine. If you have, well, if you can prove it or provide some evidence for that, and which brings us to the point, which is like the principle of certainty. How certain we are that the vaccines are working, how certain we are that they are safe, how certain we are that we can give them without what are kind of negative implications. So we need to have this way between, because if the vaccines are harmful and the COVID is harmful, then we are moving to a different principle, which is if we're working with two harms.
Harm, like which one of the two harms is less?
Yeah, so we have to choose which one is less. For example, if the side effect, there are side effects for vaccines. We all know that, right? So, but if they are 1 in 1,000, for example, 1 in 10,000. But we know that the mortality rate, the case fatality rate of COVID is extremely higher than the mortality after the vaccine. So if we're comparing both of them, then we should be in favor of the vaccine. Okay, even if we're not at this level of certainty. So this is kind of like, again, an example of how we can approach an ethical issue from using the framework of the Maqasid al-Sharia, okay, and the major fiqhi principles. So to summarize, first of all, the Islamic approach to medicine and life in general is integrated, not segregated. And this is really important to have this integration in our daily lives, and then in our studying of medicine and in our practice of medicine. The second point is practicing as a Muslim doctor has a meaning and rewarding in both lives, this life and the hereafter life. And the third is applied Islamic ethics. This is the example that we have just provided is a thing. It is there and it can be used, and it has been used a few times in the literature already. And the contemporary literature on Maqasid is really helpful. So again, the Maqasid al-Sharia, these are basically kind of like a recap of what we have discussed. We said that the Maqasid al-Sharia, they are rooted in the Quran and Sunnah, and then they have this systematic development, and they are basically divided into essentials, needs, الضروريات, essentials, and the needs, الحاجات, and then the embellishment, the التحسينيات. Okay, and for example, in healthcare, for example, it's the basic need of preservation of health, but this can be done by very basic bed sheet and the proper needle and the right IV fluid. But what we do is like we make the bed comfortable, we make it we make the room clean, well ventilated. For the children, we make some drawings on the wall. This is in Tassiniya. Okay, so this is just an example from medical care. Then maqasid are practical tools. They are dynamic, they are flexible, they can be understood and interpreted in different ways, even if fairly easier to explain even for non-Muslims. You don't have to be a scholar to understand these main goals of Islamic legislation or Islamic law. And then with fiqh principles, again, there are 5 of them. النية الأمور بمقاصدها الضرر the harm الضرر يزال, the harm should be eliminated, and the certainty is not overruled by doubt. والعادة محكمة, the custom is the basis of judgment, and مشقة تبدو بالتيسير, which is hardship necessitates ease, and there are contributions as well for many scholars that I do encourage you. I'm provided the list of the readings. Maqasid are universal, they're dynamic and adaptable. It is a holistic approach, and it's empowerment for you as a Muslim doctor to understand that you have this level of sophistication, this level of tools, because what they've been teaching you that about this framework or that theory and this and that, but in our faith we have this level of theory, even higher levels of thinking, critical thinking, of logic, of very structured approaches and very systematic way of approaching the ethical issues. Okay. So your questions, thoughts, and feedback. I mean, the feedback it will be done. I have a QR for that, but let's now keep it now for the questions, thought, and feedback. And I have handed it to Omar to.
Well, I thank you very much, Doctor. It was a very beautiful, very insightful lecture so far. I think we learned a lot. I think if I have some time for questions, are you willing to take some from the audience or?
Yeah, sure. Yeah, for a few minutes if they have.
Yeah, if there's any questions, we're happy to take some now, inshallah. So you can put some in the chat or open your mic and speak, whatever you're comfortable with.
I actually have a question. So, with regards to the preservation of life, if a patient comes in requesting termination of pregnancy and they don't have any illness or anything, like what do we do in that situation? Like,
Where are you practicing?
let's say Ireland.
Yeah, okay, in Ireland, you have the right to conscientious objection based on your religious belief. So what you do is that you explain to the patient that based on where you have your reasons that you cannot provide her with this service, tell her that this service is legal. She has the right to do that by law. However, I cannot provide this service to you, but you have the legal obligation to provide her with the information, and if needed, a referral to someone who can provide that. I understand this might not fit very well with what we have discussed or our beliefs as Muslims as well. So the termination of pregnancy, it should be within very limited or restricted condition. It's not absolutely forbidden like the Catholic Church, for example, but again, the conditions are very clear. And if you don't have a genuine cause, and this is one thing, there's an important question as well, is about the gestational age, by the way, because we believe that if it's before the installment, this is basically the first trimester, for some scholars, it can be done even without an excuse, by the way. You don't have to have to kind of a restriction or a condition. Okay, so some scholars have permitted that. Okay, so if the decision age allows, and based on the fatwa or on these schools of thought, then this could be permissible. But if you're not comfortable or not quite sure of where you stand from this fatwa, then perhaps it just follow the law, and you have at least some scholars would permit that. So you are kind of like in the safe side in that regard, even if you refer her to another facility. But as long as you're practicing in Ireland, you should be following the Irish law.
Okay, thank you. And just one more question, regarding like dealing with a patient who has put in like a request for DNR, and like let's say they're in a situation where they're unstable, is it permissible for us to withhold CPR, or should we respect their, I guess, their autonomy for the DNR?
We should respect their autonomy, legally speaking, and professionally speaking, and ethically speaking, and guess what? Islamically speaking as well. Okay, because we have no obligation to extend life artificially. Although there's a clear advice from the Prophet, Tadawu ibadallah, he advising like go and seek treatment. Okay. However, many scholars are assuming this as not as wajib, as something that you must do. It's something that it's good to do. It's good to consider. Okay. So for many scholars, there is no duty, legal, the religious duty on you or any patient to do whatever it takes to stay alive. Okay. So this is not the case. And according to you as a doctor, as a Muslim doctor, you don't have to feel the pressure of you have to do whatever it takes to keep the patient alive. You do it as long as the patient is okay with that. But many patients, they decide that I want death to come and I'm happy with it. I'm ready for it. And this is my decision, and we have to respect it. Even from a Islamic perspective as well, there is no obligation on the patient to seek the treatment like they have to, unless it's something like kind of like life and death, or something that could, for example, infectious disease. This is not a choice. They have to. They must. Okay. But for their own choice, for their own health, again, some scholars are saying that it's not a must. It's kind of like advisable. It's a good thing to seek. But if out of tawakkul, then you can do it. I see a raised hand.
Thank
Salma.
you.
Yeah, no.
Yeah, assalamu alaikum. Thank you very much for the talk. I had a question when it came to the principle of harm. So I have a very specific example, which is about chemotherapy. So obviously, chemotherapy has a lot of side effects. It's a very difficult process to go through, but the ultimate goal is the preservation of life. But ultimately, all of our therapeutic strategies, the goal is the preservation of life. So I guess my question is, what is the limit for us to consider that the harm of the thing that we're gonna put our patients through is valid in comparison to, I guess, like it's acceptable. It's acceptable for the ultimate goal of preserving life. I don't know if my question was clear.
Yeah. I think I get your, if I got your point right, it's about the assessment of harm. So that, for example, the principle said that if we're basically you're choosing between two harms, right? So if you are faced with two harms, which is one is the leaving the cancer as is and goes with the prognosis and all the implications of letting the cancer go, and on the other hand, we have the chemotherapy or whatever the intervention that we do for cancer and the harm associated with side effects, right? So we are basically balancing two harms, which is one is leave the cancer as is, and the other is to have the treatment, and again with all the side effects associated with that. As long as we are kind of like the very fact that we are comparing, this means that they are comparable. In other words, there is no clear benefit at one point of time for the chemotherapy over leaving the cancer. So as long as we are kind of like in a balance, okay, somehow comparable, so it is left to the patient to decide. It is left to the patient to decide whether they want it or not. And we have to respect that. And again, not just as an ethical, professional, or autonomy kind of thing, which is like in the secular approach, but even from Islamic approach. Because and we have seen this, that Muslim patients, they have this level of belief in Allah and the ability of Allah to cure them. And this kind of like, they left it all to Allah subhanahu wa ta'ala to decide for them. They have done their istikhara, they have asked the people they trust, and they ask you as a doctor, and you tell them that if we leave the cancer without treatment, this is what could happen. And if we intervene at this stage, then these are the side effects, and they can basically decide, and they have the right to do so, not only from an ethical professional perspective, but also from Islamic perspective. Allah.
Okay, Jazakallah khair.
Doctor, we have a couple of questions on the chat. Would you like
sure.
to read them out, or can you see?
Sure. No problem. Inshallah.
So Muhammad Ahmed asks, what should our stance be on making patients not for resuscitation when it is medically deemed that it may cause more harm or hardship than benefit? For example, extremely frail or elderly patients.
So the question again is that if the patient is on DNR or not on DNR?
The question is about changing the patient's resuscitation status.
Yeah. So again, back I'm answering here not from very like basically a medical perspective or the medical ethics perspective, but from Islamic ethics perspective. Back to the rule, right? So the DNR, what is the ruling about DNR? This is a basic question, because if we know the ruling about DNR, then we can conclude the ruling of not doing the DNR. Okay, so wallahu alam, DNR is an intervention that is intended to save someone's life. Okay, and it's fairly I would, let's say, modern or contemporary approach, a new approach to help in this. This brings us to the principle of certainty. What is the level of certainty of doing the CPR would bring this heart to life, back to beating, okay, and the person the heart could beat spontaneously, and the person can basically the circulation and respiration comes back spontaneously. Okay, and basically the person survives. So what is the likelihood? So here the principle of certainty would help us in this regard. How? By basically, if you wish, measure, or if you have numbers or the possibilities or the probabilities or the percentages, whatever the evidence that we have. Okay, so what is in the scale of certainty, with something like completely unlikely, very rare, something extremely likely, to the point of certainty. So where we are on the spectrum, it depends on where we are on the spectrum. If we are more towards doubt or illusion, or basically it's very, very unlikely that for this to work. This is one extreme. But if on the other side is where we are nearly sure, almost sure that it's going to work, then we have where we can make this choice based on the principle of certainty, because we are more certain, we're closer to certainty than to doubt. Okay, so this is one way to think, to utilize the principles. Another principle that could apply here also is that of harm. So for example, we can compare the harm of basically to attempt the DNR compared to the outcome, okay, to the harm that can be caused by the CPR. So for example, and this happens almost a lot frequent, I don't have numbers in my mind now anyway. So what could happen is that you basically to attempt the CPR, and you end up basically undignifying the patient and let them die in pain rather than dying dignified, and let death takes its path. And this is one important thing which brings us to the very beginning of the lecture. It's important to have this creed, this belief that, okay, we are tools, we are just hands, okay, but Allah is what makes the cure in our hands. It's Allah which will make a cure in the treatment that we're giving, in the antibiotic, in the chemotherapy, whatever. Okay, so it's really important to understand that, and life is coming to an end. Allah subhanahu wa ta'ala, he's telling his most beloved creation, Sayyidina Muhammad sallallahu alaihi wasallam, that you are dead, you will die, and they will die too. If the Prophet died, then why should we attempt so hard to maintain the life if we are eventually going to die? Let the people die in dignity, on their own terms, on their own at ease. Okay, so I understand that you might be very comfortable of if only I can attempt the DNR, he might survive. Yes, there is a possibility, but put it on the scale. Where we are on the scale. If you are near certain, then okay, go ahead. If the patient didn't say no, then go ahead, attempt it. If not, then stop. Don't try it in the first place. And have this yaqeen in your heart, this creed, this certainty in your heart, that you didn't abandon your patient. You let the fate of Allah happens, and that's it.
Jazakallah khair.
So sorry, could I just ask a question regarding that? You said that then we shouldn't, like, we should thrive to keep a dignified life, but then if we let the patient die, don't we go against the first one of Maqasid?
I'm not saying do not attempt. I'm saying that the attempt should be guided by, number one, first of all, by the belief that I'm not the person bringing someone to life. If Allah is declared dead, then it's dead. At the intellectual level, at the intentional level, number one. Number two, medical speaking, where we are on the spectrum of certainty. If we are near certain, I'm repeating word by word, verbatim of what I've just said. If you are near certainty or more closer to certainty that it's going to help the patient, then do it. Unless there is a consent, an advance health directive that he signed while he was competent, that I do not want DNR to me if my heart stops, let it stop. If they were competent, then we have to accept it, legally speaking, professionally speaking, and Islamically speaking. Okay, but what I'm saying is, if you are near sure that's not going to work, you are doing it only because you want to silence something inside you, like, let's just try, let's just me do it. We don't do it because we want to do it. We do what we do for our patients because we believe that it's in their best interest. So the question is, the basic question is, I'm not saying do it or do not do it. The basic question is DNR in this situation in the best interest of the patient? is the outcome more towards certainty that he will make it and the heart will beat again or not? If it's not, then you don't have, this level of commitment, of obligation to